and welcome to today's video, which is on meningitis. So meningitis is an infection and swelling called inflammation of the fluid and membranes around the brain and spinal cord. So these membranes are called meninges. The inflammation from meningitis most often triggers symptoms such as headache, fever, a stiff neck. Viral infections are the most common cause of meningitis. Bacteria, parasites, and fungi can also cause it, and sometimes meningitis can improve in a few weeks without treatment. But meningitis can also cause death. It often needs quick treatment with antibiotics. So if you have a meningitis that's been caused by bacteria, early treatment can prevent serious complications. So early meningitis symptoms can be like those that you have in the flu. Symptoms can come over several hours or a few days. Symptoms in people older than 2 years are displayed on the screen below, and it can also include, like, as well as usual ones: sudden high fever, stiff neck, bad headache, nausea, vomiting, confusion, trouble concentrating, seizures, sleepiness, trouble walking, sensitivity to light, no desire to eat or drink, and you get a skin rash sometimes, such as in meningococcal meningitis. For the newborns, you also get high fever, constant crying, very sleepy or irritable, trouble waking from sleep, not active or sluggish, not waking to eat, and poor feeding and vomiting. You might also get a bulge in the baby's head. So, viral meningitis are the most common causes of meningitis, followed by bacterial and fungal and sometimes parasitic. Because bacterial infections can lead to death, finding the cause is vital. So, bacterial meningitis is where the germs enter the bloodstream and travel to the brain and spinal cord, causing bacterial meningitis. But bacterial meningitis can also happen when bacteria directly enter the meninges. This can be caused by an ear or sinus infection or a skull fracture. Sometimes surgeries can cause it. So there are several strains of bacteria which can cause bacterial meningitis, and the most common are Streptococcus pneumoniae. That's one of them. So this germ is the most common cause of bacterial meningitis in infants, young children, and adults. It often causes, pneumonia or ear or sinus infections, and a vaccine can help prevent this infection. You also have Neisseria meningitidis. This germ causes a bacterial meningitis called meningococcal meningitis. These germs most often cause an upper respiratory infection, but it can cause meningococcal meningitis when they enter the bloodstream. This is an easy to catch infection that affects mainly teenagers or young adults. It can also cause local outbreaks in the college dormitories, boarding schools, and military bases. Once again, a vaccine can help prevent infection. Even if you're vaccinated, anybody who has been in close contact with a person with meningococcal meningitis should get an oral antibiotic. This can help prevent the disease. The next one is Haemophilus influenzae. This is also known as Haemophilus influenzae type B bacteria, which was once the leading cause of bacterial meningitis in children, but new vaccines have greatly cut this type out. And you've also got Listeria monocytogenes. These bacteria can be found in cheeses that aren't pasteurized, hot dogs, and lunch meats. People who are pregnant, newborns, older adults, and people with weakened immune systems are more likely to be affected. During pregnancy, Listeria can cause the placenta. Infections in pregnancy can be fatal to the baby. Moving on to other causes of meningitis. So viral meningitis is the most often mild and clears on its own. A group of viruses known as enteroviruses is most often the cause. Enteroviruses are most common in the late summer and early fall. Viruses such as herpes simplex virus, HIV, mumps, West Nile virus, and others can also cause viral meningitis. You have chronic meningitis, whose symptoms last. This is meningitis where symptoms last at least 4 weeks without stopping. There are many causes of this. Symptoms can be like normal meningitis, but they come on slower and last longer, and include headache, fever, vomiting, and brain fog. Fungal meningitis isn't very common, but it can act like bacterial. Symptoms start in slower and build over time. Breathing in fungal spores found in soils, decaying wood, and bird droppings can be the cause. It doesn't spread from person to person. Then you've got cryptococcal meningitis, which is a common fungal form of the disease. It affects people with an immune system, such as from people with acquired immunodeficiency syndrome. It can cause death if not treated with an antifungal medicine. Even with treatment, it can come back. You've got tuberculosis meningitis, which is a rare complication of tuberculosis, also called TB. It can be serious, and like the fungal version, its symptoms start slowly and build up over days to weeks. It can pass easily from person to person, and it needs treatment with TB medicines. You also have others like parasitic meningitis, which can cause a rare type called eosinophilic meningitis. So a type 1 infection in the brain or cerebral malaria can also cause parasitic meningitis. Amoebic meningitis is a rare type that sometimes comes from swimming in fresh water. It can become life-threatening. The main parasites that cause meningitis most often infect animals. People can get infected by eating foods that have these parasites. Parasitic meningitis isn't spread from person to person. So the other causes that aren't infections, as seen here on the screen below, is chemical reactions, medicines, allergies, some types of cancers, and diseases such as sarcoidosis. So risk factors for getting meningitis, you can also so before I go into the risk factors, you can also get complications. So these can be serious. The longer someone has a disease without treatment, the greater the risk of seizures and long-term nervous system damage. You get hearing loss, trouble with vision, memory issues, trouble walking, seizures, and kidney failure. So risk factors include not getting vaccinations. So the risk increases for people who haven't had child or adult vaccinations. Age. So viral meningitis often happens in children younger than 5. Bacterial meningitis is common in those younger than 20. Also living in groups, so college students living in dorms, people on military bases, and children in boarding schools and child care facilities are at greater risk of meningococcal meningitis. This is probably because the germ quickly spreads through large groups. Pregnancy also increases the risk of an infected Listeria bacteria, which also cause meningitis. The infection raises the risk of miscarriage, stillbirth, and premature delivery. Weakened immune system, AIDS, alcohol use disorder, diabetes, medicines that lower the immune system, and other factors that affect the immune system raise the risk of meningitis. Having a spleen also raises the risk. And for people without a spleen, a vaccine can lower the risk. So prevention. So common germs that cause meningitis are spread through coughing, sneezing, or kissing. Germs can also spread by shared eating utensils, toothbrushes, or cigarettes. These steps can help prevent meningitis. Wash your hands. So careful hand washing helps prevent the spread of germs. Wash your hands often before eating food and after using the toilet, spending time in a crowded public space, or petting animals. You can practice good hygiene, so don't share drinks, food, straws, eating utensils, lip balms, or toothbrushes with anyone. Avoid sharing these items and teach it to your children as well. Stay healthy. Keep your immune system strong by getting enough rest, exercise regularly, buying vegetables, fruits, and whole grains. Cover your mouth. When you need to cough or sneeze, be sure to cover your mouth and nose. Even better, cough or sneeze into your shoulder. If you're pregnant, watch what you eat. Reduce your risk of a listeria infection by cooking meat, including hot dogs and lunch meats, to 165 degrees Fahrenheit, also 74 degrees Celsius. Eat only cheeses made from milk that have been pasteurized to kill germs. Check your labels to make sure cheeses are made of pasteurized milk. So diagnosis involves blood cultures, imaging, and spinal tap. For your treatment, so treatment depends on the type of meningitis. Bacterial meningitis, so new onset bacterial meningitis needs treatment right away with antibiotics given through a vein called intravenous antibiotics. Sometimes corticosteroids are part of the treatment. This helps you recover and cuts the risk of complications such as brain swelling and seizures. The antibiotic or mix of antibiotics depends on the type of germ causing the infection. Until your healthcare professional knows these exact causes, you need a broad spectrum antibiotic which fights a wide range of germs. Corticosteroids can also be prescribed to reduce swelling in the brain, and a medicine that controls seizures. If a herpes virus causes you meningitis, you can get antiviral medicine. Antibiotics can't cure viral meningitis, but viral meningitis tends to get better in a few weeks. Treatment often includes bed rest, plenty of fluids, and plenty of medicines to reduce fever and body aches. For the other types of meningitis, if the cause of your meningitis is not known, you may need to wait to start antibiotic treatment until your doctor finds the cause. Treatment for ongoing meningitis called chronic meningitis depends on the cause. Antifungal medicines treat fungal meningitis. A mix of antibiotics can treat tuberculosis meningitis, but these medicines can have serious effects. So waiting for a treatment until a lab confirms that it causes either fungal or tuberculosis. Corticosteroids may treat meningitis due to allergic reaction or autoimmune disease. Sometimes you don't need treatment because the condition clears up on its own. Cancer-related meningitis needs treatment for the cancer. That's the end of today's video. I hope you've had fun and I hope you tune in for the next one. Bye bye.